Okay, good afternoon. My name's Nicola Jepson. I'm a physiotherapist here at Counties Manukau, but I've done this study towards a Master of Public Health qualification, and my supervisors were Dr. Nadia Sharania and Dr. Sarah Mooney. Oh no, I'll use this one, I think. Bronchiectasis is a worsening problem worldwide. In New Zealand, Māori, Pacific Island and disadvantaged communities are disproportionately affected. And the hospitalisation rate in the general population worsened by 41% between 2000 and 2015. In children, New Zealand children get bronchiectasis at higher rates than particularly Indigenous children in New Zealand get bronchiectasis at higher rates than Indigenous children in Alaska and Australia. There is a delay to diagnosis for children with bronchiectasis, and there are barriers to accessing healthcare. This kind of got me thinking about what are some of those barriers, and why is it that children aren't accessing healthcare efficiently and effectively? So the research question that I came up with was to look at the experiences of accessing healthcare for kids with bronchiectasis, to understand their families' experiences of accessing care at the GP, at the A&E, in hospital and at specialist clinics, and to identify the barriers and enablers to accessing healthcare and identify areas for improvement. I recruited from clinics at Counties Manukau and at Starship, and I did attempt to recruit participants who did not attend their clinic, but unfortunately I wasn't able to recruit any of those participants. The participants were the parents of children with bronchiectasis, and I performed semi-structured interviews with those parents. My data analysis was thematic analysis. The first two stages here I did manually, and the last stage I used in vivo software. I recruited 10 participants. All of the participants were mothers of children with bronchiectasis. I was looking for people, I used purposive sampling, so I was looking for people who had a wide range of backgrounds and experiences. So you can see that there are participants who had a wide range of age ranges, that's both the participant and the child, a wide range of ethnicities and a wide range of income brackets as well. I came up with 5 main themes, and I'm going to go through each of these in turn. The first one, searching for answers. This was the process of seeking a diagnosis. Participants found that they were it sort of went through stages, where at first they felt like they were in the dark when they didn't have a diagnosis and they knew that something was wrong with their kid, but they weren't quite sure what. And then they kind of went through a process which culminated in having a diagnosis and finally accepting a diagnosis. And this is a quote from one of my participants. Disempowerment, again, like the previous theme, kind of went through chronological stages as well, going from disempowerment to empowerment. A key thing in this theme was the mother improving her knowledge. So at the beginning of this stage, participants told me about how they felt really vulnerable when they didn't understand what was going on. All of the mothers were really keen to improve their knowledge of bronchiectasis so that they could know more about their child's illness and thus feel more empowered within their relationship with their healthcare provider. And this is a quote from somebody who did feel that she was able to gain knowledge and speak up, so she felt more empowered. Relationships were really important to the healthcare experience. Those people who had positive relationships with their healthcare provider felt much more confident within their healthcare experience and found that they had a positive experience with accessing healthcare. Some of the things that related to having a positive experience were communication, having familiar healthcare providers, and having healthcare providers who were willing to go the extra mile. So some examples were a healthcare provider who was willing to help with a welfare application, for example. Those participants who had negative relationships with their healthcare provider had a negative experience of accessing healthcare, and that was a really long-lasting feeling for them. An example of something that made people feel negatively about the relationship with their healthcare provider was not feeling confident in their healthcare provider. Some people told me about how they felt that their doctor wasn't confident to make the diagnosis, and one person actually told me about how they felt that their doctor was too confident and then didn't ask for a second opinion, so that also led her to feel less confident in that healthcare provider. This is a quote from somebody who talked about having to tell her story again and again and again, and that was a really recurrent story from all of my participants as well. This next theme was about parents trying to juggle a whole lot of things in their life and trying to then add their child's healthcare access into their lives. So people talked about the changing family dynamics, and 2 people even told me about how they felt that one of their children was neglected because of the greater needs of their child with bronchiectasis. Other parents also told me about juggling work and school. So they found that it was difficult to take time off work and also having to take their child out of school to go to appointments. So this is a quote from somebody who felt that real conflict between taking her child out of school and her child needing to be in school, and yet knowing that she needed to go and see the specialist at the clinic as well. The last theme was more about some of the practical barriers to accessing healthcare. So people talked about things like financial difficulties, transportation, timing. But I found that even though people talked about all of these barriers, if they found that the service was worth it, they would make it work. So one of the key quotes there from one of my participants was, "You just have to make it work." And all of the parents found that they would find a way somehow. So this is actually a story from a woman whose youngest child, who had bronchiectasis, had to go into the hospital for 2 weeks. She couldn't find a babysitter, so she took all of her 6 kids up to Starship Hospital. So in that way, she found a way, she made it work. Of course, they couldn't all stay in Starship, so she had to turn around and take her kids home, and her youngest child went home with her as well. In conclusion, parents' relationships were absolutely crucial. So it was the relationship with the healthcare provider that probably had the biggest effect on how people experience healthcare. Parents want to be treated as experts on their child. So people often told me about how nobody listened. They were telling their story again and again, and people just didn't join the dots. So parents really want to be listened to and treated as the expert. Knowledge is power. So I talked about those feelings of empowerment that came from parents gaining knowledge on their child's illness. And we need to really consider health literacy in this as well, and target our information at the right level. And as I said before as well, if a service is worth it, parents will make it work. So I really found that parents would really strive to do anything that they could to access healthcare if they could. Lastly, just some implications for policy and practice. So an emphasis on patient-centred care is really important. Now, this is not a new idea, but I don't think that it's cemented all that well in our health care practice. So it's really key to be fostering relationships and putting the patient or the parent at the centre of our care. Communication and collaboration, that's within services and between services as well. And I think that technology could help with that. And really excellent example of this is the iMoko app, which was initiated by Dr. Lance O'Sullivan, and that's linking schools and healthcare. So that might be rolled out into different services as well. I'd just like to acknowledge the research office who funded this with the Mātātupu Fund, the teams at Counties and Starship who helped with recruitment, and of course the participants of my study as well. Thank you.